Welcome everyone to the episode of Wellbeing at Work podcast series. My name is Agnello Dias and I'm the Director of Business Solutions in India for Workplace Options. I'm pleased to welcome Karthik today. He's the founder and director of Ivory Health. They deliver comprehensive employee health programs from health checks to mental wellness across India. Karthik has over 20 years of experience across banking, media and healthcare. He has built and led high-performing teams and launched successful wellness initiative across 100 plus corporates in India. He's passionate about making preventive healthcare accessible and impactful at the community level. Karthik also advises business on enterprise sales, strategies, and growth. Karthik, welcome to our podcast.
Thank you. Thank you, Agnello, for this introduction and thanks for having me.
Karthik, before we dive deeper into the conversation, could you tell us a little bit more about what Ivory Health does?
Sure. So, Ivory Health works closely with diverse communities. When I say communities, it could be corporate teams, neighborhood clusters like RWAs, or any professional associations. We understand their unique health challenges and build targeted well-being programs. Our services range from cognitive health checks, screenings, counseling, lifestyle consultations to mental wellness webinars and burnout support. Based on detailed insights, we craft personalized action plans, track progress through repeat assessments, and provide recommendations that improve health outcomes to both individual and group levels. So in a nutshell, this is what we do.
Thank you. Good to know that. In today's conversation, I will be speaking with Karthik about mental health in the Indian workforce. Before we dive in the conversation, let me provide you with some statistics regarding India's work culture. Half of Indian workforce in India puts in at least 49 hours a week, which has made India one of the most overworked workforces in Asia. 62% of Indian employees are experiencing burnout, a rate that is 3 times the global average. Countless stories have emerged of employees experiencing verbal abuse and bullying. 53% of employees in India have reported the state of their mental health impacts their productivity. 1 in 4 employees struggle to speak out about mental health challenges in the workforce. These statistics reveal a troubling reality for many employees in India. What are barriers that prevent employees from seeking mental health?
Yeah, Agnello, so yes, these numbers are worrying, and unfortunately, we have seen similar patterns in a lot of workplaces. I feel one of the biggest barriers is the stigma attached to mental health. Time and again, experts have highlighted this in various forums. There's still this hesitation, fear of being judged or being seen as, not strong enough if someone seeks help. This mindset keeps a lot of people from even starting a conversation. There's also a lack of trust. Employees often aren't sure if their concerns will be handled confidentially or taken seriously. Then there's this awareness gap. Many don't know what kind of support exists or how to access it, even if their company offers, something with regards to mental health. And lastly, the manager's role is critical. If managers aren't approachable or trained to handle these conversations with empathy, it just reinforces the silence. So while having mental health resources is important, it's equally important to build an environment where people feel safe and supported to actually use them.
Karthik, you talked about stigma, lack of trust, awareness gap, manager's role, and empathy. Can we also talk about the role a leader or a manager plays in creating a healthy workplace?
Yeah, definitely. I think leaders and managers set the tone, whether they realize it or not. Right? If a manager's only focus is on deadlines and targets and sales, the team naturally mirrors that. But if they show empathy, check in on how people are doing, and encourage open conversations, it makes a huge difference. Also, when leaders take their own well-being seriously, like setting boundaries or using mental health support, it sends a strong signal that it's okay for others to do the same. And the tricky part is a lot of managers haven't been trained to have these conversations, such conversations. So helping managers know what to say, how to listen, and how to spot early signs of burnout. That's where companies, need to step in.
So you talked about managers and leaders. What do you think an organization can do to destigmatize mental health conversations at work?
So, Agnolo, I just spoke about how companies need to step up in helping managers know what to say, how to listen, and how to spot when someone might be struggling. That's honestly the starting point. But beyond that, organizations need to make mental health a regular part of workplace conversations, not something that's only brought up during the World Mental Health Day, like we always see. It could be through internal campaigns, monthly sessions, or even casual check-ins that normalize talking about stress and emotional well-being. Also, leaders being open helps a lot. When some senior shares their own experience, whether it's a therapy, burnout, or just dealing with a tough phase at work or life, it immediately reduces the fear others might feel, in opening up. And of course, lastly, visibility matters. If a company has a counseling service or helpline, it shouldn't be buried in some policies in fine print, right? People should know it exists, how to access it, and trust that it's confidential.
So Karthik, when you're saying make mental health a regular part of workplace conversations and that leaders should be open to help, what do you think is going to change with AI coming into the picture now? What is the nature of work that is going to change in Indian workforces? Secondly, how is it going to impact the employees and their mental health?
Well, I certainly feel AI is definitely changing how we work. It's helping with automation, making things faster, and in some cases, even improving how we engage with employees, right? But when it comes to mental health, I think we are still at a very early stage. There's a lot of talk about AI being able to pick up on stress or burnout through usage patterns, but honestly, understanding how someone feels emotionally is still a very human thing, right? AI hasn't really cracked emotional intelligence as yet. And I feel that's where a lot of work still needs to be done when it comes to AI. Also, let's not forget AI itself can create stress. People are worried about job security, staying relevant, or feeling disconnected as more things go digital. So while AI can support well-being, it can't replace real conversations, empathy, or human judgment, at least as of now. So I think the key is balance. Use AI where it helps, but keep the human connection front and center, especially when it comes to mental health.
I agree. We are still at the tip of the iceberg. We don't know where AI is headed. And I also agree with your statement that AI itself can create stress. So, Karthik, you work with a lot of insurance brokers, insurance companies. What can you tell us about the role of insurance brokers in supporting workplace mental health or, as healthcare ambassadors? What do you think you and I can do in supporting workplace mental health in India?
Agnello, I think health ambassadors or health aggregators, as you may call, can play a much bigger role than just offering a catalog of services. It's not about pitching what we have. It's about understanding what the organization actually needs. I will, share a recent example where I was speaking with the HR head of a leading pharma company in India. And during our discovery process, we found that several of the senior scientists, people in their 40s, mid 40s with years of experience, were being put on the bench due to lack of active research work. Now, we have all heard of IT companies benching employees, but this was a first for me in pharma. There are highly qualified professionals suddenly dealing with uncertainty and self-doubt. The company generally wanted to support them, not just in terms of job security, but emotionally also. Because we took the time to understand the situation, we were able to design a few targeted awareness programs to help them feel seen, valued, and reassured. That kind of impact doesn't come from just selling a predefined well-being package that your organization must have. So in my view, the role of a health aggregator should go beyond transactions It's about listening, discovering, and then tailoring programs, whether that's mental health support, burnout prevention, or simply creating safe spaces to talk. Each workplace is different, and our solutions have to reflect that.
You put it really well, the role of a health aggregator, and you talked about how you were able to help the pharma company. Can you also talk about how WPO has been able to support you and your clients in improving their workplace well-being?
Yeah, definitely. One example I would like to share is from an IT company we work with. They have teams across different countries. And during our conversations, the HR team mentioned that many employees were feeling anxious because of all the stressful content they were seeing on social media as part of their job profile. It was affecting their mood, their focus, and overall mental health. The company took it seriously and wanted to support their people. So with WPO, we arranged dedicated counselors just for the team, arranged for training and awareness sessions specific to their requirements, and employees could speak up to the counselor one-on-one in confidence. Along with that, they had access to WPO's Aware program and the 24/7 helpline, which really helped. So we saw great engagement. Over 20% of employees actually booked sessions and spoke about their concerns. We also discussed about, if you remember, the utilization being so high. That shows that when support is easy to access and made available at the right time, people do reach out. And that's where WPO supported us, being there when it really matters.
Wow. Thank you so much. So 20% is a big number, and it would be wrong to say that it's always easy to achieve that number.
Yes.
Of course, as the more you do, the more you get is the formula in mental health, at least in India. And that's what I've been seeing the last decade or so. It has changed. It has evolved. With COVID, we could see the ups. Now we are seeing the downs. And eventually, with the uncertainty, the war-like situation, we did see a lot of employees being anxious and wanting to reach out. What do you think is going to happen in the next 5 years? How do you foresee the mental health taking shape in India and in the workplace?
Well, Agnello, I think we are definitely at a turning point. In the next 5 years, mental health is going to be seen as a core part of employee well-being, not just something extra that the company offers. There will be more structured programs built into HR policies and a bigger push towards prevention, like burnout checks, regular emotional wellness sessions, and manager training, etc. And what gives me hope is the kind of companies we are seeing step up. For example, we recently worked with a spices manufacturing company in India, not a sector where you would typically expect mental health to be a priority, right? But they were genuinely committed. They invested in counseling sessions, group awareness sessions, and even manager sensitization. That shows a real mindset shift. Like them, we are seeing more and more companies across industries, manufacturing, pharma, logistics, etc., take mental well-being so seriously now. So I think we'll continue to see more openness, better support system, and a healthier work culture across the board.
Karthik, thank you for your time today. It has been wonderful discussing with you. Before we close off, I wanted to highlight workplace options, well-being programs and trainings through customized programs and comprehensive global network of providers and professionals. Workplace Options supports employees to become healthier, happier, and more productive at work. For more information about these programs and other mental health well-being services, please visit our website at www.workplaceoptions.com or contact us at services@workplaceoptions.com. These contact details will also be posted on the podcast page. Once again, thank you all for listening. Until next time, take care.